everyone, I'm Dr Becky Appleton, and in this video in the series I'm going to focus on how you should set up a focus group or interviews. Starting off with thinking about your sampling and recruitment strategy. Firstly, who are your target population and what is your sample size? This really depends on your research question, so it's hard to have a one-size-fits-all approach here. In general, for interviews, anything from 8 to 20 is seen as acceptable in research, and similarly for focus groups, you could aim for a similar sample size overall, but divided maybe into 4 or 5 smaller focus groups. When deciding on the number of people in your focus group, you don't want there to be too many. You should also decide on a sampling approach, so how you're going to identify these participants. This could simply be convenience sampling, so as you see people, as in clinic, as you meet members of staff, you would ask them, can you take part in my interview? However, a better approach is to use something like purposive sampling or maximum variation sampling, where you're aiming to get diversity within your participants. You should also ensure you have a representative sample to make sure you're able to hear diverse views. Aim to include a range of genders, ages, and people from different areas. This could be staff with different professions, for example, depending on your exact research topic. Different sampling strategies include using existing mailing lists, putting up posters, sending out targeted invitation emails to people who meet your eligibility criteria, and posting on social media, for example on something like X, Blue Sky, or LinkedIn. One word of caution if you do choose that latter approach. We know that sometimes people will try and take part in research even if they don't meet the eligibility criteria, especially if there is some incentive for taking part. Therefore, we recommend that if you do recruit over social media, just add in an extra step of checking that somebody is actually eligible and that they are who they say they are when they do your study. Here are some things to consider when setting up individual interviews. It's generally good practice to have some flexibility in timings to make sure that the interview takes place at a time that is most suitable for your participant. Will you want your interviews to take place in person or online over something like Teams or Zoom? Sometimes I find that being able to see somebody either over video or face-to-face is helpful and can help develop a rapport quicker than telephone. Can you offer participants the choice so that they are able to take part in a way that feels most suitable for them? You should also make sure that the participant understands what taking part will involve. This information is usually presented in a participant information sheet, which is shared with potential participants in advance of the interview taking place. Participants will also have to give informed consent if you're doing this as a research study, and you should have prepared a copy of your participant information sheet and consent form to go along with your approval for ethics. It's also good practice to give participants the opportunity to ask questions, just to make sure that they understand what taking part will involve and what will happen to their information. All of those previous points apply to setting up focus groups too. However, there are some additional considerations. Sometimes it can be hard to get a group of people together in one place at the same time. Therefore, there are some other considerations that you can make to try and make recruitment a little bit easier. One strategy which can work really well is attending an existing group. So this could be if there's already a staff meeting in the diary that you could attend and then run the focus group at, or if there's a meeting of a patient and public involvement group or a patient group within a certain time frame that you could then go and run your focus group at. Other strategies which I've used in the past which work well are doodle polls and sign-up sheets, where people add their name and contact details to a sign-up sheet for however many slots are available for that particular focus group. It's also important to consider group dynamics and who will be attending. For example, sometimes it might be tricky if you have focus groups comprising staff and their managers, as this might mean that staff don't really want to talk freely in front of people who are more senior to them. You may find similar difficulties as well with groups made up of both patients and staff. Therefore, it's generally good practice to split up these participant groups and offer these focus groups separately. In general, it works well to aim for around 5 to 7 participants per focus group, although exact numbers again do depend on the type of study you're doing. If you have too many participants, this risks not everybody being able to speak, whereas you want to be able to hear from everybody you've recruited. You may also want to account for 1 to 2 participants dropping out on the day, but still have sufficient numbers for the focus group to take place. There are a few other practicalities to consider too. For example, how will you record your interviews and focus groups? Will you use dictaphones, or if they're online, will you use the recording function through Microsoft Teams or Zoom? Once you've recorded your interviews or focus groups, how are you going to transcribe these to be able to get data for analysis? If you have extra funding, you could maybe use an external transcription company. If not, then you may have to transcribe interviews yourself, which is a really long process. One potential middle ground could be asking Microsoft Teams to do the first round of transcription, which you would then check for accuracy afterwards. It's generally good practice to check the accuracy of transcription anyway, even if it is done by an external company, so that might not be a bad option. Keeping a data collection notebook or diary can also be really helpful as you go, so over the course of time period where you're doing your interviews or focus groups, writing down any initial thoughts or notes that you could use either in future interviews or to help you with data collection at the end. After the interview or focus group, there are a few steps that you should do. Firstly, thank the participants for taking part and ask them if they've got any feedback on the interview process. It's also good practice to offer to share a summary of the findings. This means that once you've finished your research, you'd write up a short, accessible summary written in plain English. You should ensure that your data is saved securely and that all of your transcripts are anonymised. When thinking about data security as well, you should make sure that data can only be accessed by you or other members of your research team. It's also good practice to give each of your participants an anonymous identifier and save any of the transcripts relating to that individual under that identifier. Once you have finalised the transcripts, you can go ahead and delete the audio files. During transcription, this is where you remove any other references to names, places, or dates, or anything which could potentially identify your participants. Now that you've got all your data, you can focus on your data analysis. Your exact approach to analysis may depend on your research question and the type of project that you're working on. It's good practice to involve other team members and people with lived experience. Data analysis can be done either by hand, as shown in the picture example here, or by using a qualitative software like NVivo. This can be really useful as it lets you change different codes and merge codes together, either if there's some in duplicate or when you want to start creating categories or themes. However, both approaches work equally well, and this is in part down to personal preference. Here is one example of part of a transcript. This is from a participant in a fictional study exploring the lived experiences of older adults adapting to life after a major stroke. You can see here that different sections of their response have been given different codes. Where they mention the comparison with before the stroke, being out and about all the time, this has been coded to stopping previous activities and also to comparisons. Where they've spoken about not being able to use their left arm properly and struggling with walking, this has been coded under physical impacts. If you were choosing a thematic analysis technique, then you would go ahead and do this for all your transcripts. Once you've finished coding, you can then merge these codes into categories and finally into themes. Here is an example of what these themes and subthemes can look like. This is actually data from one of my previous papers, where I explored reasons for falling through the transition gap between child and adult mental health services. In total, I identified 2 overarching themes. The first was systemic barriers to continuity of care, and the second was problems with quality of care received. Each of these are broken down into 3 subthemes. In systemic barriers to continuity of care, these are not being ill enough for adult mental health services, inadequate service provision after leaving child and adolescent mental health services, and a lack of joined-up care between services. You can see that each of these 3 subthemes makes a specific point, however they all come under the umbrella of systemic barriers to continuity of care. If you're planning to do qualitative research for the first time, I really recommend looking at other qualitative research papers which have been published in your field, both to see examples of studies that exist, but also to see what you're aiming for. What does this look like at the end once it's been published? Here are a couple of other links you can use if you're interested in finding out more about qualitative research. And you can see the direct link on screen to the catalogue hosted on NHS's Learning Hub platform. Registration is free, and if you have an NHS email address, you'll have free access to both the Learning Hub as a whole and the WE-R NHS catalogue resources. We have links to podcasts, videos, and journal articles on a range of topics related to education and workforce research. WE-R NHS is on YouTube, and we also have a regular e-newsletter. Thanks very much for watching.